Hello, everyone. Um, I am Vaishnavi Kowshik. I am a counseling psychologist at Mindspace. Today, we are going to talk about understanding and managing anxiety disorders. We're going to learn causes, symptoms, and effective coping strategies. So today is about introduction to anxiety, types of anxiety disorders, causes and risk factors. We'll understand symptoms and diagnosis, the impact it has, and we're going to end with coping, treatment strategies, and some case studies and real life examples. A little bit about me. I have master's degrees in counseling psychology and cognitive neuroscience with expertise in mental health research and intervention. My goal is to increase mental health awareness and accessibility, especially in areas where awareness is limited. So, why this webinar? I've always believed in the power of psychology to transform lives, and today I'm here to share insights and help individuals understand and manage anxiety disorders. So, let's get to it. Introduction to anxiety. What is anxiety? Anxiety is a natural reaction to stress or perceived danger. It's the body's way of reacting to stress or perceived danger. It activates the flight and fight mechanism, preparing us to deal with threats. Occasional anxiety is normal and even beneficial in certain situations, such as preparing for an exam or a job interview. Then, if anxiety is normal, what is the difference between normal anxiety and an anxiety disorder? While normal anxiety is temporary and proportionate to a situation, anxiety disorders involves excessive and persistent worry that interferes with daily life. Unlike normal anxiety, anxiety disorders do not subside once the stressor is removed. So, if a situation is leading to stress, like attending an exam or attending a job interview, once the exam is done or once the job interview is done, usually the stress goes away. If it does not, if the stress still persists and continues towards other daily activities or other situations in life, that is when that is when the anxiety has become a disorder. So, prevalence statistics globally, anxiety disorders affect about 4% of the population. In India alone, it is estimated, it is estimated that 4.5 crore people suffer from anxiety related conditions. Yet, many cases go undiagnosed due to stigma and lack of awareness. And this webinar is one small attempt to create awareness, spread awareness about anxiety disorders. So, types of anxiety disorders. Anxiety disorders comes in various forms. Let's just go through some of them to understand a few. Generalized anxiety disorder. It is characterized by excessive, uncontrollable worry about daily life events, even when there is little or no reason to worry. Panic disorders. This involves sudden episodes of intense fears, often accompanied by physical symptoms such as heart palpitations or shortness of breath. Social anxiety disorder. It is an overwhelming fear of social interactions, often leading to avoidance of gatherings, public speakings, or even meeting new people. Phobias. Extreme fear of a particular object or a situation, such as heights, or flying, or animals. Usually, phobias are misinterpreted to be just fear. It is normal to have fear about certain objects or certain animals, but when it gets intense, when it gets more irrational, that's when it is a phobia. Obsessive compulsive disorder. So, this is marked by a persistent, intrusive thought and repetitive behaviors. It's obsessions and compulsions. This is usually performed to reduce anxiety. The last one is post traumatic stress disorder. This develops after an exposure to an event that has been traumatic to an individual. It causes flashbacks, nightmares, and severe anxiety. These are some of the forms where, in which anxiety manifests to an individual. Let's understand the causes and the risk factors. So, anxiety disorders arise from combination of genetic, psychological, or environmental factors. Even in biological causes, genetics plays a role, a major role, as anxiety disorders often run in families. Brain chemistry imbalances, particularly neurotransmitters such as serotonin and dopamine, play an important role in creating anxiety. Psychological factors, having past trauma or having a perfectionist tendency or even negative thinking patterns increase the likelihood of developing an anxiety disorder. Environmental influences, high stress lifestyle, financial difficulties, social pressures, and major life changes such as loss of a loved one or moving to a new country even can trigger or worsen anxiety. So it so all of these impact an individual in multi-dimensional way. For example, having just negative thinking pattern will not lead to an anxiety disorder. So if an individual goes through all of these, for example, genetically, if an individual is more prone to having a anxiety disorder, and then that person also has negative thinking pattern and has faced some trauma in the past, and if that individual has like a stressful lifestyle or financial difficulties, or something that's environmentally causing him to be more prone to anxiety, it is more probable that he or she will have an anxiety disorder. So it does not happen individually, right? So all of these have major roles to play, and in the combination, it is more effective for an individual to have an anxiety disorder. So let's understand the impact of this. Mm. So anxiety can affect daily life. It can disrupt work, studies, and social interactions, making it difficult to complete everyday tasks even. On relationships, persistent anxiety may cause withdrawal from loved ones or difficulty maintaining healthy relationships. Even comorbidities occur, comorbid conditions occur due to anxiety. Meaning anxiety disorders often coexist with depression or substance abuse and other mental health conditions, increasing the risk of long term impairment. So, you can see how anxiety disorders impact an individual in daily life, as well as like having coexisting conditions such as depression or because of anxiety, substance abuse is more probable. So how it impacts an individual's daily life so much that they cannot come out of it very easily, or also go through life in a normal way. So let's understand some of the symptoms and diagnosis. Anxiety manifests through physical symptoms such as racing heart, sweating, or rapid breathing, dizziness, nausea, and muscle tension. Some of cognitive symptoms can be persistent worry, difficulty concentrating, overthinking, and intrusive thoughts. Some of the behavioral symptoms can look like avoidance of anxiety provoking situations, restlessness, irritability, and compulsive behaviors. Then again, having just a racing heart or constant worry or just intrusive thoughts alone does not equate towards a disorder. Like I said about the causes, symptoms with a combination of of physical, cognitive, and behavioral symptoms usually leads towards a disorder. If it's just one of these, it is just a normal anxiety, or anxiety that is recurrent but can also be easily handled. But when it gets to a combination of all of these, that is when it becomes a disorder. And it is more hard to manage those, or to even get past the situation when there is a disorder, when there is a period of anxiety disorder. So, a mental health professional uses DSM-5 criteria to diagnose anxiety disorders. It's usually through clinical interviews and standardized assessments. So, DSM-5 is a reference book which has information about mental health related issues and brain related issues. That's what a clinical professional would refer, and do a set of series of standardized assessments along with understanding the different kinds of symptoms to diagnose a disorder. Let's get to the coping and the treatment strategies. Effective treatments include self-help, practicing mindfulness, deep breathing, and physical exercise. These can help reduce anxiety symptoms. Um, Lifestyle changes, even changing the diet, sleep, and reducing stimulants, can have tremendous impact. Just practicing some of the techniques that a professional would teach you. There is a certain way to practice mindfulness and deep breathing, and its impact is phenomenal, and it's momentary. It momentarily changes the way anxiety, or your body adapts to changes the way the body adapts to a situation. Changing the lifestyle, like I said, changing diet, having nutritional diet every day, having about 6 to 8 hours of sleep for a continued period of time, um, can have a tremendous impact. Like, it can have an exponential impact in an individual's life. Therapy, the kind of therapies that are used for treating is cognitive behavioral therapy, and cognitive behavioral therapy, exposure therapy, and mindfulness based therapy. So, CBT is highly effective treatment that helps individuals reframe negative thoughts, recognize the thoughts that an individual is having, understanding whether it's rational or irrational, and restructuring them uh, into a more understanding and a positive way, can be very helpful in handling anxiety. Um, and exposure therapy is also beneficial for cases with phobias and PTSD. Exposure therapy is when an individual is made to face fears directly, but also with the support, with the help of a counselor. When the counselor is present, it's more of a hand holding procedure where the fears are made to face, and then it gradually improves in having the command over fear. So some of the medications, such as SSRIs and benzodiazepines, are prescribed by psychiatrists. If such therapies do not have like do not seem to impact an individual as effectively as it would, that's when medications might be necessary, and only psychiatrists can prescribe them. Having support group and peer support can individuals feel less isolated and more empowered in managing their anxiety. And it is highly recommended to be part of support groups, to be helped by peers, um, It helps in evolving an individual through anxiety. Seeing another person also going through a similar difficulty will less isolate a person, and help the individual. Now, about case studies and real life examples. Let's consider examples let's consider a few examples, one with social anxiety and another with panic disorder, and how through therapy and gradual exposure, um, they learn to manage their fears and build confidence. Sharing real life cases can help illustrate effectiveness and treatment strategies. So, case study one, overcoming social anxiety in a university student. Background, for confidentiality purpose, the names and the actual details of the client has been altered in both the studies. So, background, of the first one, let's say the name of the patient is Rahul. He's a 20-year-old university student. He has struggled with extreme social anxiety. Since childhood, he has had a fear of being judged by others, which intensified during his college years. Simple tasks such as introducing himself in the class, participating in group discussions, or asking questions to professors has caused him immense distress. Challenges that he has faced are, he has avoided social interactions, even participating in group projects and public speaking. He has experienced rapid heartbeat, excessive sweating, and trembling even while interacting with people. Over the time, he has developed these negative thoughts, such as everyone is watching me always. I'll embarrass myself if I do something in front of a group of people, and everybody will think that I am stupid. If I talk in a public speaking competition, people will think that I am stupid. So he's developed these negative thoughts over a period of time, which has made him to avoid all of like which has made him to avoid extracurricular activities, such as debate or public speaking, despite of him wanting to participate, despite of him liking these events. He has avoided such scenarios. So um, so he had to take therapy because he did not wanted to go through his university with these problems, with these challenges, which is why he went into therapy. And then there were a few interventions therapies that were used on him, such as cognitive behavioral therapy. So Rahul worked with the therapist to identify and challenge his negative thoughts. He practiced reframing them into more realistic ones, such as, his thoughts, like I said, were, I'll embarrass myself, or they think they think I am, like, people usually think that I'm stupid. So he reframed that into, even if I made a mistake, people won't judge me as harshly as I think. So things like that. So he first understood that he had these thoughts, because it's not easy to understand what negative thoughts you have when you have anxiety. So it takes a process. It is a process to recognize that. So I am having this anxiety in certain situation because this is the thought I'm getting, right? So understanding the thought, recognizing the thought, and then understanding the irrationality of it, and then restructuring them into a more rational way of thinking, or more positive way of thinking. Like in his case, like, even if I make a mistake, it's okay. People will not judge me so bad as I thought, I assumed people would. So that eased him into cutting slack with himself. Like, it's okay, even if he makes a mistake, it's okay, I will still participate. So another therapy was exposure therapy. He started with small exposures, such as making brief eye contact and greeting classmates. Gradually, He progressed to speaking in front of a small group, then participating in class presentations. So exposure therapy is very beautiful. I personally like it so much, and it helps in a lot of fears and phobias and PTSD situations. So that is when a counselor creates situations like, in with the help of a counselor, a person is made to, or the client is made to go through these stressful situations, and understand what might come, or what problems a situation might give him, and then gradually facing them, gradually, like step by step, trying to face, like in his case, like making brief eye contact, practicing it in a close setting with a counselor, with the help of the counselor, and then implement, like trying to have the control of the situation, and then implementing in real life scenarios. It is very impactful, and I personally would completely vouch for an exposure therapy. So things like these. And he was also made to practice mindfulness and relaxation techniques. He practiced deep breathing, progressive muscle relaxation, and visualization exercises before any social situations. He learned how to do this, and then practicing this, when he expected a social situation would happen, tremendously helped him to ease his anxiety, to put his body out of the flight and fight mode. So, with the flight and fight mode, when the body gets into that mode, I will not get into too much of the details, but it changes the way the body thinks, the brain thinks, or sorry, the mind thinks, and changes the way the body reacts. So, relaxing the body, relaxing the brain, or decreasing, like doing such activities to decrease the heartbeat, can tell the brain, or tell the body, in turn, that it's not a stressful situation. So it's not something that, um, like an individual is not in grave danger. So reiterating that, using these breathing techniques and progressive muscle relaxation can be very helpful, so that the way brain thinks shifts completely, so it's not in survival mode anymore. So with more ease, it's more easy to face such situations. There was also social skills training that was given, in which Rahul learned communication techniques. He learned assertiveness and strategies for handling social interactions, which helped him very much also. So the outcome, after 6 months of therapy and consistent practice, Rahul's confidence improved significantly. He participated in class discussions, joined a debate, and even gave a speech at a college event. Though he still experienced occasional anxiety, which is still fine, by the way, it is completely normal, he had developed effective coping strategies to manage it, which is why it is absolutely essential to learn these coping mechanisms and practice them on a daily basis. Because therapy is still, like taking therapy is important, but that still has an end date. It starts at some point and ends at some point. But coping strategies and these techniques are the ones that come with you in all, like in all of your situations with stress, right? So practicing coping strategies and like, keeping them in mind and practicing them, and yeah, it's really helpful, to have these. So let's get to the second case study. It's called managing panic disorder in a working professional. Like I said, because of confidentiality, the real names or the details have been switched to a different one. Let's say the name of this person is Aditi. She is a 32-year-old marketing professional. She began experiencing sudden panic attacks without any apparent triggers. The first attack occurred while driving, where she felt an intense fear of losing control. heart palpitations, dizziness, and difficulty of breathing. Over time, she became fearful of having another attack, which led for her to avoid certain situations such as crowded places and public transport. The challenges that she faced were frequent panic attacks, sometimes in important work meetings as well. She had fear of being in public places, which led to a phobia of situations where escape for her might be difficult. And she had this constant anticipatory anxiety, worrying about when the next panic attack might happen. She had difficulty focusing at work because of all of these. It led to decreased productivity and frequent absences. Not just in work, she had a lot of difficulty in her real life, like in her, other personal life as well. So it's very unfortunate that somebody has to go through panic attack because it is very close to having an actual heart attack. But the symptoms almost remain the same. And it is a very scary situation for an individual to be in because like while somebody is going through a panic attack, you don't know what's happening to you, and it just happens at a random time. Like for her, the first event happened when she was driving. So when it happens at a random time and when you're not prepared for something like that, you don't know what's happening to you. It's what your body is going through, and you don't know how to navigate such a situation. So it is a difficult position to be in. So she also had such a difficulty, and she had this anticipatory anxiety as well because it just happens at a random time. You never know when, like if an individual has had a history of panic attacks and it has not been cured, there is no there is no reason as to when it would come. There is no, you cannot track a panic attack. It would just come at a random time, which is unfortunate and scary at the same time. So because of all of this, Aditi had to go through therapy. And after the diagnosis, understanding the symptoms and the diagnosis, therapist decided to go through these intervention techniques for her, which was again cognitive behavioral therapy, but it was more panic focused. So Aditi learned about flight and fight response, and that panic attacks, although uncomfortable, were not dangerous. She practiced cognitive restructuring to reduce catastrophic thoughts like I am going to die, or things like I said, when and first of all, understanding what flight and fight response is, how the body perceives stress, and how it switches to a flight and fight response itself gives us the like one step, gives us the knowledge to handle such a mode. So while she was going through such a situation, she thought she was going to die, or she did not know what was going to happen, like what her body went through. So understanding the panic attack and the thought that came right after such panic attacks, and then restructuring them into something like, this is just my body reacting to stress and it will pass. So just restructuring the thoughts and understanding gave her an upper hand in handling panic attacks. And she also went through interoceptive exposure therapy. She was gradually exposed to physical sensations that mimicked panic attack, such as her panic attack made her have like hyperventilation, or something like heartbeat raising or something like that. So she was gradually exposed to these symptoms, these physical symptoms, which helped her to desensitize uh, her fear of such symptoms. Like because it happened at random times, she had developed fear of such symptoms. So she, like, her breathing started racing, her heart started racing, and her breathing picked up. So exposing herself, exposing her to such symptoms which gave her fear, and also along with mindfulness and restructuring the thoughts, helped her desensitize the fear of such symptoms. And then she was also introduced to breathing and grounding techniques, using deep breathing techniques, and progressive muscles relaxations, helped her regain control during the attack. Like even while the attack was happening, although she couldn't like take control yet, like like during the time where she was like still going through therapy, while the attack was happening, the panic attack was happening, she was in the observant mode. She could see what was happening to her. She could understand that this is what she was feeling and this is what the body was going through. And being in the observant mode helps you not react or not create thoughts such as, oh no, what's going on, I am going to die, or things like that. So being in that observant mode and relaxing her body using deep breathing, helped her to calm herself down and pass through the panic attack phase very quickly. It was short lived because she could practice these momentarily when they happen. And she was also asked to make some lifestyle adjustments. She had to reduce caffeine, which was much more than the advisable amount. Like having more than 3 to 4 cups a day, concentrated, or a black coffee repeatedly in a day is not advisable, especially when there is more stress. Or even reduce it to one, or maybe even lesser than that, especially when there is stress. Because of her work, she also had a very bad sleep hygiene. So, improving that, having 6 to 8 hours of sleep every single day, mm, at between 10 to 6 a.m. or in the night, not during the late nights, helped. And incorporating daily exercises and meditation helped regulate stress. So daily exercises were absolutely essential for her, especially being in the corporate field. She had to put some effort into like having some movement in the body to release that stress. So all of these helped her regulate stress levels. So the outcome, over 4 months, Aditi experienced about 75% reduction in panic attacks. She regained confidence in traveling alone, attending meetings without fear, and eventually took a leadership role as well in the company. She still carried coping strategies like breathing app and calm music, but no longer lived in fear of panic attacks. So this not only helped her work, her personal life, her life as a whole, holistically, improved tremendously after going through therapy. And her, even though it seems too intense, the panic attacks seem too intense, she could overcome that in just a period of 4 months. She had changed her, like transformed her life into a completely different situations in a completely different way, which is next to magical, if you ask me. So these are some of the call to actions and resources that I would suggest after this webinar. So now that some of you who have watched this video throughout, watched this webinar throughout, you have educated yourself. You are made to understand what anxiety disorder is. I would highly encourage you to educate others as well, make others also understand what you have just learned, and practice some of these self-help techniques and mindfulness. This is like widely available on YouTube as well. Some of these very simple mindfulness techniques. You have some of the apps also that helps you. So I would highly encourage you to practice it. And if you see somebody who's going to, who is nearby an anxiety disorder, if you think that some of the symptoms I said mm, is something that an individual is facing, I would encourage you or somebody you know to seek help. Be supportive to friends and family who might be struggling. Then that's very important for somebody who's going through going through anxiety. Having a circle, having a community, or having just somebody to um, you know support is very essential. So stay connected to this, stay connected or to this, to understanding this on YouTube, in other sites. um, Look at resources, follow for future sessions, and all of that. And thank you for being part of this conversation. Let's continue to break the stigma around mental health and support each other in this journey. Your mental health matters, so take care. And remember, you're not alone. Thank you.